Hi, I'm Dr. Carl Bamlett, and today we're going to share with you a few health tips.
So, Carl, just following on, you talked before about inflammation. If someone does need to use some medication during this time to manage some pain or an injury that does occur, what would be your recommendations in that space?
Well, that's a very good question because there will be some injuries, and you can't get in to see anybody. It's unable for me to be working right now. GPs aren't working. Osteos, physios, yourself, where you can't be seeing people face to face. No ability to help them out. So there's a few different categories that these painkillers are going to fall into, and anybody who's had old injuries or has chronic pain, they're going to have other things in there too for painkillers that we'll talk about, but the average person won't be able to get them over the counter. So the most common things we see over the counter are called NSAIDs, or non-steroidal anti-inflammatory drugs. And these work in a similar path as the turmeric and the boswellia do that we talked about in the last video. But they're going to have some worse side effects overall. So one of the big things that these drugs do is they can, if they're done in too high levels, they can affect and give stomach ulcers. That's one of the big worries with a lot of the non-steroidal anti-inflammatories. Some of the order of things kind of that these would fall into, you have the ibuprofen, you have diclofenac, naproxen, Celebrex, and aspirin. They all kind of fall into that category. And different ones, what they can do and what they can't do. So Celebrex is a real specific one that's only inhibits COX-2 mechanism, which leaves the gut alone, but this is really known for affecting livers. So that's one that's it's in that category, but it's different, and it's got some pretty significant effects on the liver there. So that one, people are mixed on what they do with that. So take with that what you will as viewers out there. Ibuprofen are pretty tried and true. Over the years, they can, in prolonged usage, have some serious effects. But if we're in a pinch and we need something, it's one that can do a bit of work for us. That's the NSAIDs. If we get into the next layer of drugs, we get into the opioids, and there's a few different ones here. We have the codeines, the tramadols, and whole long list of different ones that we can get, and those are going to be opioid-based pain receptors. So they affect your brain's perception of pain, is how they work, rather than stopping the inflammation. And the difference in those different drugs is the other chemical-based things in there. So they all bind to the opioid receptors in the brain and in the body, but they have different chemical structures which will have different effects on the body. So the different ones will affect people differently, and I'm not going to be giving any advice around that, but that's how those work, and they're going to be a completely different effect than the NSAIDs. And then some of my chronic pain patients, they're on things like pregabalin and gabapentin for nerve pain that I don't put them on, but that's what they get put on at a certain stage when they're dealing with those nerve pains. And that's going to be a whole other mechanism of action. That's working on a whole different mechanism in the brain, and it's shaped like GABA, but it doesn't work on the GABA mechanism in the brain. So it's a little bit more hard to tell what that one's doing in the brain, but that works for nerve pain in a lot of cases. So in the spectrum, the NSAIDs are what we get over the counter, and doing the ibuprofen is one of the things that personally, if I were to injure myself and I couldn't get in to see someone that does what I do, that would be probably what I would have to go with on a scale. But I can't give anybody recommendations out there as what they should do.
Awesome. Thanks, Carl. It's really good to clear that information up. It's great. Thank you.
Thank you for watching our video. This has been Dr. Carl Bamlett, the Modern Caveman, helping you live your modern day life using wisdom from the past. Thank you.